Today we're going to talk about a medicine called Spironolactone that we use to treat acne in women. And we're going to talk about why or when somebody should consider using spironolactone. Welcome. I'm Dr. Kolsky. I'm the founder and medical director of Advanced Acne Institute. We're a specialized dermatology practice. We only treat acne, so we're very unique in that respect. And we have various insights from our experience in being such a focused practice that we like to share. And this is done for educational purposes only. This is not medical advice. So spironolactone is a very useful medicine that we have in treating acne in women. And oftentimes it becomes an option that can be very productive and very helpful. A lot of times women will experience acne that we call hormonal pattern acne, for example. Now, all acne is related to hormones. Hormones are they occupy one of the first steps in acne formation. If you look inside of an acne-prone pore, you'll see there's a structure that is comprised of a hair follicle and an oil gland together. And that is really the substance of the pore. And hormones are the triggers to make the oil glands in that structure become overactive and start to form acne. So spironolactone works by blocking those hormones. It actually gets in between the hormone and the pore so that the hormones cannot overstimulate or overactivate that acne-prone pore so acne doesn't form. So spironolactone in that respect is a very effective medication. Now, we typically talk about spironolactone in many of our female patients because it can be very useful since it does work at the very root of the problem. It's not working as a Band-Aid approach like some of the other treatments can. For example, some of the topical medicines that we might use or some of the pills like antibiotic pills, those typically are more Band-Aid approaches. They're not really getting down to the root of the problem, whereas spironolactone can. Now, especially when a patient has a hormonal problem, such as polycystic ovary syndrome, called PCOS. So that's a favorite time when women are often given spironolactone to address their acne problems, because in PCOS, the elevated levels of certain hormones can cause an increased propensity to have acne, and using spironolactone can get to that level of hormone production to block the ability of those excess hormones to overactivate the oil gland. So that's a favorite time to use the medicine. But oftentimes it can be used in all women. Now, it's not always effective. Some women don't respond. But the majority of women that we use this medicine in do show a good response. So it becomes a very effective medication. The side effect profile is usually very, very safe. That's a discussion that every patient has to have with their own medical provider because everybody's circumstances and everybody's medical history is somewhat different. But overall, we find a lot of usefulness for this medicine. And after using it for 1 to 3 months, we typically start to see the results, and our expectation typically is to get completely clear skin. Now, one of the drawbacks is that there's really no endpoint. So you would take spironolactone as long as you needed to take it. And it's typically safe to take for long periods of time. But as far as how long you'd be on the medicine is a decision that is made between each individual and the medical provider that's prescribing it. But overall, it's a very useful medication. We use it a lot at the Advanced Acne Institute, and it often can have very good results.